My name is Bruno Scheller. I'm interventional cardiologist working at the University Hospital of Saarland in the southwest of Germany, which is close to the French border. And I'm also a full professor for clinical and experimental interventional cardiology at Saarland University. So the treatment of coronary in-stent restenosis remains a challenge. If you look, for example, at numbers from the United States, more than 10% of all catheter-based coronary procedures are related to the treatment of re-narrowed stents. So this is a relevant clinical problem we have to deal with. In Europe, we have two preferred treatment options for the treatment of in-stent restenosis. Number one is the implantation of a second drug-eluting stent. And number two, with the same high level of evidence, is the use of a drug-coated balloon without the implantation of another layer of metal in a restenotic stent. The advantage of DCB-based treatment is that you avoid additional layers of metal, which increase your risk for stent-related events over time. You have only to address the mechanical problems of the initial stent, and repeated drug application is done by the balloon. And this may turn out in, if you look at very long-term follow-up, in lower clinical event rates with reduction of death or myocardial infarction. So that's the big advantage of a balloon-based treatment of in-stent restenosis. However, if you look at the available data in some of the trials, TLR rate is somewhat higher with DCB-based treatment of in-stent restenosis compared to stent-based treatment with the two layers, because the second stent gives you another mechanical force to open the lumen. For balloon-based treatment, the quality of lesion preparation is a very essential step. If you look at the available drug-coated balloons, almost all are coated with paclitaxel. Why? Because paclitaxel has persistence inhibition of cell growth if it's done locally. Whereas Limus agents like sirolimus, which are dominating the stent-based treatments, have a reversible binding to the mTOR receptor complex, and this means if you will have a longer-term efficacy in restenosis prevention by Limus drugs, longer-term release is mandatory for this treatment.